Hi, welcome back to Straight Talk. We've been having an amazing discussion about transgender, about the LGBT community, support for people. It's just been a very powerful experience hearing their stories. Well, here in Baltimore, we have a really amazing agency that really does great work and has for many years called Chase Brexton. They do a little bit of everything. They're terrific. And joining us is Amit Dhir, who's a nurse practitioner. And Amit, give us a little overview, if you can, about Chase Brexton.
Yes, of course. Well, first, glad to be here. So Chase Brexton is healthcare is a federally qualified health center located in Baltimore, Maryland, in the Mount Vernon neighborhood. We were founded in 1978 as a volunteer-run gay men's health clinic. That was actually the name of the clinic, just volunteer work. And in the 1980s, our work took a new and a difficult challenge to be in the front lines of the HIV/AIDS epidemic. And since then, we've been in the front lines of, HIV treatment, HIV prevention, LGBT care. And in about 1995, we opened our doors to primary care services to people from anywhere, people from all, races, gender, communities, ethnic backgrounds. So we do it all, like you said.
Now, when you think about Chase Brexton, you think about HIV, about AIDS, but like you said, you're doing a lot more. What, medication-wise, what are we seeing now that we didn't see 5 years ago when we talk about HIV and AIDS and hepatitis? There's just a lot going on.
Yeah, so since 1980s till now, treatments have changed drastically. Lives have improved. People living almost normal lives, thanks to our, scientists working tirelessly to produce, discover, and make new medications every year. From cocktails of medications today, now it's one tablet daily for most people. And those medications have the least side effects, which allows you to have less effects on your organ systems like heart, kidneys, liver, and people are thus living longer and almost normal lives with HIV treatment.
Yeah, that's pretty amazing. The same with hepatitis. Also, there's new medications, right?
Correct. For hepatitis now, for a few years now, we have cure for hepatitis, multiple tablets, multiple medications made by multiple different pharmaceutical companies. Now we have tablets that one size fits all. Doesn't matter what type of hepatitis you have, you just take that same tablet, which anybody else would take. And the cure rates are in the high 90s, 90% for cure. And I barely have seen anybody not get cured these days from the hepatitis C treatment. And also, talking from the perspective of primary care, HIV used to be a specialty. People used to be scared of it in terms of from the primary care, doctors, nurse practitioners, physician assistants, they would send patients to infectious disease specialists. Now, the model of care have changed over the years. Now it's another chronic primary care condition, which if you educate yourself about it, you should be able to take care of it. We follow that care continuum at Chase Brexton, where when patients come to me, I am not just their HIV provider, I'm also their primary care. So I take care of everything for them, because I think it is important to understand what different guidelines exist for primary care HIV, because it's different from the regular primary care guidelines. So people do need to understand that. But we do need to provide a collaborative, holistic care to our HIV patients who are now living longer, normal lives.
Right. And that also includes, I know Chase Brexton has done a lot with substance abuse and some mental health services as well.
Absolutely. So we are one-stop shop for many things. We have an amazing psychiatry department staffed with, physicians and NPs and therapists. Our patients are able to get in pretty quickly with our own services. We have dental department. We have OBGYN services for our female patients, and otherwise for any women's health needs.
And again, you said this is open to anybody who needs the help, whether regardless of their ability to pay, sliding fee scales. You've got it all set up so we don't have to turn anyone away.
Correct. So Chase Brexton is open to everyone, regardless of who they are, where they're from, and what their financial situation might be. We serve all. I think that's why we are in the middle of the city, and I think we are such a glue to the city who, we're able to provide such good services to the community, including primary care, HIV, and we are the largest HIV prevention clinic in the city also, I think in Maryland.
Yeah. Well, what we hope is people watching this show from other states, other cities, can look up a place like Chase Brexton and be able to get the same kind of service. But hopefully if they give you a call, maybe you can help refer them to a place out of state if they're calling from another city or another state. But what you guys are doing is pretty amazing. And Chase Brexton, as you said, has been around a long time and has done amazing work. So I want to thank you, Amit Dhir, nurse practitioner at Chase Brexton here in Baltimore. But for those of you watching in other cities, look up kind of a wraparound service to get help for the people. Amit, thank you very much for being on the show.
Thank you so much.
Take care.
It was my pleasure. Bye-bye.